Can HPV lead to the need for a colposcopy? Have you ever wondered how human papillomavirus, or HPV, could impact your health? Specifically, can it lead to the need for a colposcopy? The answer is yes. Infection with high-risk types of HPV, particularly types 16 and 18, can indeed result in a recommendation for a colposcopy. This procedure is crucial for examining the cervix closely for any precancerous or cancerous changes, especially when screening tests show abnormalities linked to HPV infection. HPV is a common sexually transmitted infection, and while many types are low risk, certain high-risk types, especially HPV 16 and 18, are strongly associated with the development of cervical precancerous lesions and cervical cancer. Cervical cancer screening usually involves a pap test, which looks for abnormal cells, and HPV testing. If a patient tests positive for high-risk HPV types or has abnormal results from a pap test, further evaluation is often necessary. Colposcopy is typically recommended in several situations. For instance, if HPV genotyping identifies high-risk types like HPV 16 or 18, even if the pap test results are normal, a colposcopy may be advised. This is due to the high risk these types pose for cervical intraepithelial neoplasia grade 3 or worse, which are precancerous lesions. Additionally, if there are abnormal pap test results indicating high-grade lesions, or if a patient has persistent HPV infection, a colposcopy is warranted. Moreover, if a patient has two consecutive positive HPV tests alongside normal pap test results, this may also trigger the need for a colposcopy. Other risk factors or screening abnormalities that suggest a higher risk of cervical precancer or cancer can also lead to this recommendation. During a colposcopy, the cervix is examined under magnification, and biopsies may be taken from any suspicious areas. This helps confirm the presence and severity of any precancerous changes. Medical guidelines emphasize that colposcopy is a vital step in the early detection and management of cervical precancer and cancer. It allows for timely treatment, which can significantly improve outcomes. For lower-risk HPV infections or minor abnormalities, healthcare providers may recommend repeat HPV testing or pap tests at intervals before proceeding to a colposcopy. This approach ensures that only those who need further evaluation undergo the procedure. In summary, high-risk HPV infection, particularly with type 16 and 18, can lead to the need for a colposcopy as part of cervical cancer screening and early detection protocols. Colposcopy plays a key role in identifying precancerous changes that requiring treatment to prevent progression to cervical cancer. Always consult with a healthcare professional for personalized advice and guidance on cervical cancer screening and management.